What is IVF? Why do people need IVF? What kind of people come to you?
IVF is in vitro fertilization, where the fertilization is happening outside the body. The eggs then they are kept with the sperms to fertilize on their own.
How much time does this whole process take?
The stress has a big role. Smoking, alcohol. So all these things, they affect the hormone. We ask them to do it before 35 years of age so that we get better quality of eggs.
What about an IVF? Do people come and say they want a male child? Are there IVF clinics which are illegally doing all this? What are the things that you want people to know? This is how it is.
Male cannot try for IVF or surrogate.
So how did Karan Johar have kids? So childbirth is one of the biggest things that Indian families want. But fertility issues come in and create a big barrier. We are very fortunate today that we have Dr. Ila Gupta with us. Dr. Ila Gupta is a founder, director, and runs Fertility, an IVF and fertility clinic in Delhi. Dr. Gupta, thank you so much for coming.
Thank you so much.
And the first question I have for you, which is a very primary question that has been on my head, is what kind of people come to you? And why do people need IVF? Is it because they're not able to have a child? Or is it because they want to delay having a child?
See, all kind of the people, when they want to delay the pregnancy or they are facing problem in conceiving, or they're just for the preconception counseling. When they're planning to have a baby and they want preconception counseling, what test can be done, how we should move on, how we should plan for pregnancy, and if we are medically and physically fit to have a baby. So these are the three categories.
Okay.
So youngsters who wants to conceive and they want the counseling also, they want the basic tests done also to know everything is okay. So that is one group. The second group is when the female partner is less than 35 years of age and they have been already together for more than 1 year, still pregnancy is not happening. Then they start looking for the fertility specialist. Another group is when the female partner is more than 35 years of age and we tell them don't wait for more than 6 months. If nothing has happened for 6 months, then please start looking for the fertility specialist, because the age of the female partner, it plays a very important role.
Okay.
Because with the age, the number of the eggs starts going down, and it's not only the number, the quality of the egg also starts going down. The genetic changes starts happening in the egg. That's why there was an old concept. The family used to say, please complete your family before 35 years of age. Because after 35 years of age, the risk of miscarriage, the risk of birth defects, the risk of congenital anomalies, all these are very high. The third group is where they get married late, they want to plan pregnancy late, n number of reasons. They are looking for the career, or they are not financially ready, or they are not mentally prepared to take the responsibility. There they come for the options to look for, and there we advise them to go for egg freezing. If the female is married, then we advise them to go for embryo freezing, because there we know the sperm, the availability of the sperm will be there. But if the female is unmarried, then the option is to go for the egg freezing. And this egg freezing and embryo freezing can be for as many months or as many years, whatever the couple wants up to. It can be, as per the law, we can freeze them for more than 10 years or 10 years.
So another very primary or basic question which a lot of people in the society are not aware of, including me perhaps, is what is IVF? In very basic layman terms, if there is somebody watching this who's struggling with pregnancy or conception and is saying, okay, maybe I should also get IVF done. What is IVF?
IVF is in vitro fertilization, where the fertilization is happening outside the body. See, usually the fertilization takes place inside the body, where the female, if we see the female reproductive organs, there are 2 ovaries, 2 fallopian tubes and 1 uterus, which is in the center, and they are very close to each other. So every cycle the female ovulates, the egg comes out and the egg is picked up by the tube. Then the fertilization happens inside the tube and embryo grows inside the uterus, where the pregnancy further grows. Now if there is any problem in the tube, if the tube is blocked, if the tube is unhealthy, or even though they are open, they are not functioning, they are not picking up the egg. So when the egg is not picked up inside the tube, the fertilization will not happen. So when the fertilization will not happen, the pregnancy will not happen. So that fertilization is then done outside the body, the tubes are bypassed.
Got it.
The tubes that have no role in IVF. So this is the basic principle of IVF. The eggs from the ovaries are collected, we take the eggs out, and this is also a very simple procedure which is done under ultrasound guidance. The needle is introduced through the vagina. It's done under general anesthesia and it's a daycare procedure.
Okay.
Patient can go back home 2 hours after the procedure, and it is painless because it's done under anesthesia.
Okay.
So the eggs are taken out, and those eggs then they in the petri dish, same day we ask the husband to give the semen sample.
Sure.
And the eggs then they are kept with the sperms to fertilize on their own.
Sure.
So this is IVF. Now it's not necessary whoever is coming to us, this is the first treatment or the first line treatment. It's not that. So when the couple comes to us in the OPD, the first most important thing is we evaluate the patient. We take the complete medical history, like what is the age, what is the duration of being together, if there's any previous history of pregnancy earlier, any history of abortion, any history of childbirth. If they are being together, means they have been cohabiting also, or if there is any sexual dysfunction in any of the partner.
Sure.
So, and any history of medical illness, smoking, alcohol, the type of the job profile, which gives us an idea if they are under job pressure or any kind of the stress. So the complete history is important. Then physical examination, basic blood test, which includes the hormonal parameters, and that female partner is physically, medically fit to go ahead for the pregnancy. So these are the first step, basic test and the complete history and evaluation. Now for the female partner to conceive, the 3-4 most important thing, one is she should ovulate at the right time, the egg should come out at the right time. The second important thing is the uterus, which should be completely healthy. The inside of the uterus cavity should be normal. And third thing is the fallopian tubes. The both sides the fallopian tubes near to the ovaries, they should be open, they should be healthy to pick up the egg when the egg comes out.
Sure.
For the male partner, the semen parameters should be normal. And those semen parameters are checked by the basic test, that is semen analysis, to know what is the sperm count, to know the motility of the sperm, how they are moving, and the morphology of the sperm, that is the shape of the sperm.
Okay.
So as that the WHO has fixed the criteria. So as per the WHO, the count should be minimum 16 million per ml. The movement of the sperm, if we see the fast progressive movement and slow progressive movement, should be around 42%.
Okay.
And the morphology of the sperm, that is the normal percentage of the sperm, should be at least 4%.
Okay.
So the WHO has a very strict criteria of assessing the parameters, especially the morphology part.
Can you elaborate on this 42% and 4%? I mean, this sounded too technical.
42%, see the movement of the sperm. The sperms are moving in the field.
Oh, okay.
So unless and until the
sperms
is the total movement moving. Moving means the forward, one is the forward progressive movement.
Sure.
So that percentage of the forward progressive movement of the sperm is responsible for the pregnancy.
Sure.
Because unless and until the sperm move forward, how will they reach to the egg?
Sure.
So that movement is very important.
So you're saying 42% of
The motility is the range.
Okay.
So it can be 35, 40, 42, this is the range. So these parameters should be normal.
And what was the 4%?
Is the shape of the sperm, the normal morphology as we call.
Okay.
There should not be any defect in the head, neck, the body and the tail of the sperm.
Okay.
So it's a shape. If you have seen the sperm,
Right, right.
okay, so there should not be any defect.
Got it.
So it's not that 100% you will get the normal morphology. The 4% normal morphology is more than enough
Wow, okay.
to have the pregnancy. So these parameters, these are the basic tests to check for if there is any problem in any of these, and then based on that we decide how we have to move ahead with this particular patient.
Okay.
So always when the person is looking for fertility issue, it is an individualized treatment. It's not a blanket treatment for
Got it.
everyone you are doing the IVF.
So it's not like every couple that comes to you?
Yes, it's for IVF, no. So at first level is the complete evaluation, physically, medically, test, which are the basic tests which are required. And based on those reports, then we discuss with the patient where the problem is, and accordingly we'll move ahead, whether it's a IUI or IVF, or they can try naturally for some time to see what is happening. So natural conception, then first line of treatment is IUI, intrauterine insemination. And if these two not working, then we move on to IVF ICSI.
Okay.
Or if the tube test says tubes are blocked, the tubes are not healthy, then we straight move on for IVF. Then there's no point doing IUI or waiting for natural conception to happen. Because if the tubes are blocked, then we'll be wasting time. So then we counsel the patient accordingly, because the tubes are not able to pick up the egg, so the fertilization will not happen inside. Now we have to bypass the tubes.
Sure.
Or if the semen parameters are not okay, either the count is very low, or the movement of the sperm is very compromised, or the morphology is very, very poor. Very, very poor means less than 0.5%.
Right.
Then the answer is to move on for the ICSI.
Okay.
That is to select the sperm and inject inside the egg.
Okay.
So based on these parameters, we decide for a particular couple how we have to move ahead.
Right.
This is the thing.
So tell me, another term that I've heard is the test tube baby. IVF and test tube baby are
Same.
synonyms.
Yes, they are same.
Same.
For laymen,
same.
Now
When people say test tube baby, at least in my head, it's almost like it's being produced in a test tube.
yes.
Is that true?
No, the
No.
petri dish,
Okay.
where they are left, the eggs and the sperms are left to fertilize on their own.
It's not like a baby will be
No,
living
in the
test
test tube. No. And in the petri dish also, you check for the fertilization status, and you can grow them till day 3, day 5, day 6. There are stages of the embryos. And then either you're freezing them or you are transferring them into the womb of the female partner to grow the pregnancy there.
Got it. If we talk about the timeline, so let's say a couple comes to you on the 1st of January. For all the tests to happen, and let's say finally IVF is done. So you do try the natural, you do the test initially, you check it, from what I've understood, the natural process of it can be done. Then you check the other IUI. And then finally you say, okay, let's do an IVF and let's move with that. And then the IVF process begins. From the time that the couple comes to you, till the time that they get a baby, on an average, how much time does this whole process take?
It takes 5 to 6 weeks time. This is also on the higher side. Now, when the couple is coming to us, the treatment start, the basic investigations are done, and then the treatment start from the day 1 or day 2 of the cycle. So day 1 or day 2 of the cycle means when the female partner starts bleeding.
Okay.
That day we do the ultrasound. If everything is okay, if blood tests are okay, then we start the hormonal injections.
Okay.
And those hormonal injections are to produce multiple follicles.
Okay.
Because naturally, the female produces only one follicle.
Okay.
So to have multiple eggs in a IVF cycle, we have to give them the injections.
Okay.
And those injections will be roughly for 8 to 9 days daily on an average. Now, dose of the injections of the hormone will depend upon many factors, like the age of the patient, AMH of the patient, ovarian reserve, BMI, and if she has undergone IVF cycles before, then how she responded in previous IVF cycles. So based on all these things, we decide the dose of the injections for that particular patient. And those injections, they are given roughly for 8 to 9 days. In between, we'll be calling them for ultrasound to see how the female is responding to the injections which we are giving. So that is the follicular monitoring.
Okay.
And once the follicle size reaches roughly 17 to 18 millimeters, then we presume now the eggs, they are ready inside, they are mature. We do the blood test, the hormone test to assess, and based on that, we give the trigger injection.
Okay.
Now, trigger injection is to have the mature eggs. So that when we take the eggs out, they are mature to fertilize. And once they are ready, then and we have given the trigger injection, then 35 to 36 hours of the trigger injection, we take the eggs out.
Okay.
So the taking the eggs out is again a very simple procedure. It's done under anesthesia, under ultrasound guidance, and it's done vaginally. So there is no cut, no stitch.
Sure.
and the patient goes home 2 to 3 hours after the egg retrieval.
Okay.
Then the eggs which we have retrieved, the same day we ask the husband to give the semen sample, and we also keep a backup of the sample, semen sample. Sometimes the male partner is so stressed out or they are unable to give the semen sample on the same day when we take the eggs out.
Sure.
So if we'll not have the semen sample on the same day, then we'll have to freeze the eggs. We'll not be able to fertilize the egg. So to avoid that situation, we always keep a backup of the sample.
Okay.
Whatever is scheduled for that patient, IVF or ICSI, it's done. And then next day we check for the fertilization status and the growth of the embryos. Now, there are two types of embryo transfer. One is the fresh embryo transfer cycle. The another is the frozen embryo transfer cycle.
Okay.
Fresh embryo transfer cycle means when we are doing the embryo transfer in the same cycle. When we have given the injections and when we have taken the eggs out. That is fresh embryo transfer cycle. The frozen embryo transfer cycle is when we are not doing the embryo transfer in the same cycle, but we are freezing the embryos and then giving a 1 cycle break. Then we prepare the patient for the embryo transfer and doing the embryo transfer. Now, if we are doing the fresh embryo transfer cycle, then it will take 3 to 4 weeks time. But if we are planned for frozen embryo transfer cycle, then it takes little longer, 5 to 6 weeks to complete the cycle. But then they will get a break in between.
Okay.
So now which patient to take for the fresh embryo transfer cycle and which patient to take for frozen embryo transfer cycle, it also depends for many conditions. Like every cycle has 2 phases. One is till the egg collection, where the eggs are important and the embryos are important for us. And second phase is once we have the embryos, then the uterus is important for us.
Got it.
Because we have to transfer the embryo there, and it is ultimately in the uterus only the pregnancy is going to grow. So the uterus should be healthy. The endometrium, that is the lining of the uterus, should be ready to have those embryos.
Got it.
And if the uterus during the stimulated cycle is not looking okay, if the thickness is low, the character has gone beyond it has reached to the advanced stage, then we don't do the transfer in the same cycle. Especially in the PCOS cases, polycystic ovarian syndrome, or the endometriosis, we like to freeze the embryos, give a 1 cycle break, and then prepare the patient for the frozen embryo transfer cycle. So it depends. If we are doing fresh embryo transfer cycle, it will take 2 to 3 weeks time. If we are doing frozen embryo transfer cycle, it may take 5 to 6 weeks time.
Okay. One more thing that you said in the beginning was people, you try and understand their lifestyle. Are they smokers? Are they drinkers? What kind of jobs are they into? If you can shed some light on how do these things impact a couple's ability to conceive a child? How does a job impact? How does...
See, if we look at the factors why the infertility is on the rise. The earlier, I've been into this field since last almost 30 years. Now earlier it used to be the main cause of infertility was the tubal factor in the female partner.
Okay.
The tubes, fallopian tubes not healthy or they are blocked maybe because of any kind of infection inside.
It was almost
the most common infection is tuberculosis. That was the main reason for infertility. Now the trend has changed. Now the more common reasons are the male infertility.
Okay.
Yes, it has been on rise and very steep rise since last few years. Both.
Both are growing.
Both. And in female partners, beside the tubal factor, there are other factors now which are coming into play. And those are the low ovarian reserve. That is the most important factor. The eggs are going down drastically.
Okay.
The number, because once the female partner, as the age advances, the number goes down. That is the normal trend. But if the age is only in 20s or in early 30s and you get low ovarian reserve or the low AMH, so that is the cause of concern. Because the low AMH should be after the age of 40 years.
Okay.
So if in 30s only the person is having low AMH or hardly any egg reserve, so that's why the increased incidence of all these IVF cycles and the fertility issues.
Okay.
Now, what could be the reason of these low AMH or the uterus recurrent infection, and in males, the male infertility, the sperm count going down,
Yeah, what are the reasons?
the motility going down. So, most important is the lifestyle.
Okay.
Now, if we see today's lifestyle, especially in the youngsters, there is lack of physical activity, no exercise, then the eating habits. Home cooked food, hardly now anyone, I'm talking especially about the youngsters. They don't have time to cook the food. Whatever is easily available, they just have it and move to the office. The stress factor is increasing, maybe because of the job pressure. Now, one is doing the night duty. When the one partner coming back home, the other partner is leaving for the duty. Smoking, alcohol. So all these things, they affect the hormones.
Smoking, alcohol have an impact on.
They have an impact on the gametes, both on the eggs also and the sperm also, genetically.
And so does stress.
Yes, the stress has a big role in infertility. Because fertility issue is one thing which is still it's not 100% taken over by the science. Now science is, it's trying to improve the chances of pregnancy by all sorts of treatment.
Sure.
But still, if the stress factor is too high, because if you look at the pregnancy, if you look at the menstrual cycle, all this is controlled by the hormones. In female, there are FSH, LH, estrogen, progesterone. These are all hormones which controls the menstrual cycle, which controls the egg formation, which controls the pregnancy. In male, there is a testosterone hormone, FSH, LH. So this pregnancy as such or the fertility is all controlled by hormones. Now when we are under stress, any kind of stress, the stress induced hormone, that is the cortisol, it comes into play, and which has a negative impact on these hormones. Even the simple menstrual cycle, it gets disturbed because of the stress factor. So that is, it has a very important role. And how can you cope up with the stress? The exercise, the physical activity, yoga, meditation, all these have a very important role in today's life. So whenever the couple comes to, this is the first line treatment. This is the first line counseling to all the couples to have, because when we take the history, we come to know how stressed they are. And fertility issue as such is a add-on to the stress, because there's so much of social pressure, family pressure.
So the way society is headed, if you look at it,
Yeah.
right, the materialism is growing. There is more and more pressure on children today to excel in academics, get into an IIT, get into Stanford, get into IIM, work for top companies, good startup salaries. Right? That's really what the urban population lives for.
Yeah.
Or entrepreneurship and whatever. And everything is very age dependent. By 25 this should happen, by 30 this should happen. You're not a millionaire yet. You don't have a big apartment, big car, you don't drive a BMW, so all those things start playing a role. And the society is becoming more and more focused towards this. Does that mean infertility issues will continue to grow?
See, the lifestyle which today is, like, now the marriage age is also increased.
Yeah.
Hardly you see anyone getting married at by the age of 35 years.
Yeah.
Then the planning pregnancy. The people, now the age group which comes to us in the OPD for the treatment, they are beyond 37, 38 years of age. By the time the egg reserve has already gone down. So that is the problem, because they are more focused towards their career. They don't want to have any more responsibility of raising the family. So what option they have? Then they can go for egg freezing or the embryo freezing.
In fact, marriage as a concept has shrunk its significance. Right? A lot of people are today not even planning a marriage.
Yes.
Right? They've got multiple partners, or they live in, and they break up, then they go to somebody else. And so I'm assuming it's much later that they decide that they want to have a child.
Yeah.
And so that will impact. The other thing which I wanted to ask you was, I've got friends who are living in the US, or kids who are living in the US and working for some of the largest multinational companies in the world. And I know that some of these companies, I will not name them, but some of these companies sponsor it, pay for freezing your eggs. Right? So there are companies which are saying you are in the prime of your career.
Yeah.
If you get pregnant, then you need paternity leave, or the lady will take pregnancy leave, and even the father gets time off over there. And these big companies are saying that I need you at this time. So if you want to have a child, sure, but if you don't and you want to freeze it, we will pay for it. So they don't force it, but they in a very subtle way
convey this to the couple.
Almost encourage you not to have a child right now. Right? And I've heard that talks are happening even in the corridors of Indian companies, their Indian branches, Indian offices, where they are saying, well, in San Francisco, in the office, they pay for freezing the eggs. In India, also, we will start paying for it. And again, they're not forcing it, but when somebody is paying you for it, it makes it easy and it encourages it. What are your thoughts about this?
See, now if you're too career oriented, ideally everything, as I believe, is the time, it should be done timely, because the biological clock is ticking. You cannot stop it. You cannot delay it. Okay. So if you really is focused more towards your career and you want to delay the pregnancy, so that is one option. That is egg freezing or the sperm freezing. So that if you want to plan the pregnancy after 1 year, 2 years, at least your eggs will be of the age when you have frozen the eggs.
Sure.
And the ideal time to freeze the eggs should be before 33 years of age.
Okay.
So that you get good number of eggs which are frozen, and they should be genetically healthy also, to prevent from all those complications.
You're saying even for IVF, ideally do it before 33.
Yeah. See, if you know the reason, that this is the reason with me why I am not conceiving, and IVF is the only option, then why to delay it unnecessarily?
Sure.
There is no point delaying it unnecessarily, unless and until you fall into a category of unexplained infertility, where you don't know, all your tests are normal, where you don't know why the conception is not happening, and you're not mentally prepared to go for IVF. It's okay. But if the already semen parameters are disturbed, already your tubes blocked, or your egg reserve is very low, then there is no point delaying IVF cycle.
Right.
So people who are not planning for pregnancy in near this thing area time, then they can freeze their eggs and they can freeze their sperm semen sample. But now freezing the semen sample is much easier. They just have to give the semen sample. But freezing the eggs, again they have to go through the same step as the IVF cycle.
Okay.
Because they just cannot come to us and say, I want to freeze the egg. So there also we have to give them the injections to prepare the follicles. We have to take the eggs out.
Right.
And then instead of fertilizing the egg with the sperm, we'll be freezing the eggs. And those eggs can be frozen for as long as they want to.
Oh.
Yeah.
There is no limit to how long?
There is no limit. They can be frozen for as long as.
So the ideal age is below 33, or up to 33.
33, 35. Because beyond that, the number is going to go down and genetically. But even now, if you are 35, you don't have any other option, so you'll have to go for it. Otherwise, after 40 years of age, the graph is hardly 5% chances of IVF.
So the chance of success reduces as age goes up.
Yes.
But the possibility is still there.
Possibility is still there.
Even a 45-year-old can come in.
If the AMH is okay, the ovarian reserve is okay. But then the risk of miscarriage and the birth defects will be very, very high.
Or even defects.
35, 45 years.
Okay. And tell me, when people come for freezing the egg, when the lady is going through this whole entire treatment, is there any side effect? Can there be any?
No, usually there is no side effect. No side effect.
It's a safe procedure.
Yes, it's a safe
No
procedure.
need to worry
Yeah.
about any side effects. Okay. So you're saying ideally do before 33, but even later, if you need to do it because you don't have an option, you can do
You can do it.
But be aware, as age progresses,
Yes.
there could be even birth defects that can happen and the baby.
With the age, the chances increases. So that's why we ask them to do it before 35 years of age, so that we get better quality of eggs and good number.
Especially in India, while on one side families want a child, having a child, hamara bacha, hamara vansh, is a very important factor for the parents, grandparents, extended family, and all that. It's a big celebration when you find out that the daughter-in-law is expecting. And the other big factor is having a boy child, a male child. Right now, in natural pregnancies, also I know a lot of people go around and try to find out if they can get the testing done and find out if it's a boy, and I know that it's illegal and all that. What about in IVF? Do people come and say they want a male child? Do they?
Yeah, people come. We counsel them, we explain them. It's not possible in India. This is not legally allowed. This is one thing. Then another thing is what I feel personally. See, everyone wants to have a girl child and a boy child to complete the family. But even if there are two girls, they should be happy.
No, should be. I agree. They
Yeah.
should be, but people are not.
So the counseling is important. See, counseling, that is not in their hand to have a boy or a girl.
Correct.
And it's not in our hand also.
Right.
The company is more important, sibling is more important. What I believe is the first child is important for the parents, and the second child, see, it's important for the first child to have a company to share the thing. There are many couples when they go through IVF, they have a child and they just give the consent to discard their extra good embryos. They'll say, no, we will not come for the second child and we don't want a second child.
Okay.
Now, when the first child reaches 7, 8 years of age, and then the child start demanding when the child looks around, that friend or the other friend has sister or a brother, and I don't have anyone to play with or to share with, then the couple is under stress. That is known as a secondary infertility, and then they come to us. Now we want to have a second child.
But then it's too late.
So second child is because the couple never wanted to have a second child. Now when the first child demanded for the company or to have a child, then they come to us. So whether it's a girl or a boy, it hardly matters. So I think that counseling to be done to the parents. You just don't go by what your family is demanding to, because I have seen many couples, they come to us saying that keep our family, my mother-in-law or father-in-law, my mother or my brother, they want to have a
Male child.
So it should not be that. The child is for you.
I totally agree. It should not be like that. But I'm saying in our country, unfortunately, it is like that. That a large part of our country or some part of our country, I don't know what the percentage is very keen to have a male child. Right? So is that a big ask from IVF clinics where they are assuming that these kind of things are possible? And are there IVF clinics which are illegally doing all this?
See, I have no idea about the other IVF clinics, but whoever, there are people who come to us asking for this, but my straight answer is no, and I try to counsel them. If you have a girl child, till you are looking for pregnancy, go ahead for pregnancy, but don't think about that you will get a boy if you go for IVF.
Sure.
Whatever happens, the child should be healthy. That is more important, whether it's a girl child or a boy child.
Right.
So that is my
two
first counseling.
Connected questions. One, can a couple have more than one IVF child? Is there a law about?
Yeah, they can have more than one IVF. Suppose if they have a child with IVF earlier, they can come again for the second child.
Oh, I for some reason thought.
No, it's for surrogacy. If you have a child earlier, then you cannot go for surrogacy for the second child. So that is the surrogacy law.
Somebody did mention doing for surrogacy. But for IVF, you can have more than one.
More than one, yes.
Is there a number?
No, it's not a fixed number. But usually they don't go beyond two.
Sure.
Most, like I think 99% they want to have only 2 children, not beyond that.
The second is this male child concept. So we have a law that you can't, even tell the parent what the sex of the child is, or and you of course can't enforce a male child or a female child. What about outside India? Do people, is it allowed there? Do people go outside India and get these things?
There are countries where it's allowed, where it's legal.
What are the things that you want people to know that legally, this is how it is? For example, how many IVF clinics are there in India? Can anybody start it? Is there a license for it? How does law control what is happening?
See, suddenly there was mushrooming of the IVF clinics, IVF centers. And so the government now has come up with the ART law. So there are certain rules and regulations for the clinic, for the doctors, and they have made the guidelines also how we have to practice. Like the clinic should be registered with the ART authority. Then they should have the specialist who have done the fellowship or who have worked into IVF, who is well aware of the procedure, about the rules and regulations. Anyone who is just doing obstetrics, who have no idea, cannot do IVF like that, or who is only MBBS, they cannot do IVF. Then we should have the in-house embryologist. Like in our center, we have 2 senior embryologists who are full-time there and 1 junior embryologist. Then they have given the specification also for how big the clinic should be, what all should be there inside the clinic, and what all records we have to maintain. We have to give the records to the ART authority. All the consent forms are there, which are designed by the government for the patients to sign. So all those consent to be taken, they should be explained, they should be counseled. Then there are rules for the donor cycles, donor egg IVF, donor sperm IVF cycles. There are ART banks. We cannot have the direct donors, whether they are donating the eggs or donating the sperm. So now there are many things have come into
Right.
place.
So
And
people can donate eggs and donate sperms.
yeah,
A person, a female or a male, come in, want to have an IVF without having a partner.
yeah, single women is allowed to have IVF.
Single women can.
Single women is allowed to have IVF.
Okay.
If suppose the woman has her own eggs, then she can go with her eggs, she can go with the donor sperm, and the embryo is transferred into her womb. But if suppose the female is beyond 40 years of age, or
Right.
because of any reason, if she is not able to produce eggs, then she can go with the donor egg, she can have donor sperm, and she can carry the pregnancy. But she cannot have all the three things from outside. From all the three things means the donor egg, donor sperm, and she cannot rent a womb,
So one of the three has to be
her own.
the person.
And single male cannot try for IVF or surrogacy.
Oh. Why is that?
This they have not given any reason for
So-
that, but this is
Okay. So how did Karan Johar have kids?
surrogacy.
And maybe outside India.
There are also laws, yes, clear cut.
Govern this whole thing.
And surrogacy nowadays it's not that easy
Oh, is it?
because they have to have their own surrogate. We cannot take the surrogate from the ART banks. So surrogate should be a known person. The couple has to bring their own surrogate. The couple should be married
Okay.
and should not be. It's not that a single female or male can go for surrogacy. No. The couple should be married. Then they should not have any child before. Then only they can go for surrogacy. And they should have a valid reason to go for surrogacy. It's not that they on demanding they cannot go for surrogacy. There has to be a valid reason, and then they have to take the permission from the state board authority.
Okay.
If the permission is granted, then only they can move on for surrogacy.
Okay. So if people come to an IVF clinic like yours and they're looking for surrogacy, do IVF clinics, yours or not yours, do IVF clinics have connections with people who are willing to be surrogate mothers?
No.
No.
Now we cannot do that.
Okay. Earlier.
Earlier it used to be before law. There used to be ART banks who used to provide the surrogate, but that is banned. So commercial surrogacy is totally banned now.
Okay.
It's altruistic surrogacy.
To be,
Has to be through the couple.
but through the couple, it can be anybody?
It can be anybody. Firstly they said it should be the relative, but now the known person should be there. Can be the relative or can be any other person, but should be through the
Can't be
Couple.
formally a commercial arrangement.
yeah.
Right? So
Should
it might
not
be
be
somebody
commercial.
paying and using for that. Any words of advice in the end for couples who are struggling to conceive or who are late 20s, early 30s, late 30s, or thinking about IVF, thinking about having a child? Any words of advice for them?
My advice would be to have a healthy lifestyle and to plan for pregnancy at the right time. If you know the reason why it's not happening, look for the specialist and follow the advice of the specialist. Before planning, your lifestyle should be healthy, the regular exercise, good physical activity, well balanced diet, avoid alcohol and smoking, and should know how to cope up with the stress. Because I cannot say that stress is not, avoid stress. Stress at some phase of life may not be there, but one should know how to cope up with the stress. That is important. And when you're planning for the pregnancy, you can visit the doctor, you can get the basic tests done to see everything is okay, and then you can move ahead. And if you find any problem, then don't wait for long, immediately see your specialist and follow whatever the specialist advises.
So, with decades of experience that you have, I'm assuming, and I'm sure there are more experienced doctors around, but you're one of the more experienced people. How do people reach out to Fertility?
See, by word of mouth, the patient who conceive, they send the patients to us, they send their friends. Yeah, through the media. Now the awareness is also increasing. Pehle all these social media was not there. Now the awareness is there. So people know that if they have this problem, then this is the answer to it, or this is the solution, and what is to be done to know where is the problem.
That's very valuable information, even I didn't know. Thank you so much, Dr. Gupta, for coming and sharing all this information. It's been a learning for me, and I'm sure a learning for a lot many people.